Each legislative session, KHI is hard at work, keeping you informed on the latest health policy discussions from across the street in downtown Topeka. Health at the Capitol is a KHI production, a monthly recap with our legislative monitoring team, offering you a closer look at policy work happening now in Kansas and coming up. Thanks for joining us for Health at the Capitol. We are wrapping up the first month of the 2025 legislative session. My name is Teresa Freed. I'm the Director of Strategic Communication and Engagement for the Kansas Health Institute, also your host for today's Health at the Capitol. And of course, I'm joined by Linda Shepard. She is our strategy team leader for state and federal health policy. So always, Linda, thanks for joining today.
Thank you, Teresa.
All right, so it is off to a busy start at the Capitol building, and I know there are lots of different topics that are being addressed, lots of activity, so we will kind of dive right in. So what are some of the topics that are being addressed related to health right now?
Well, thank you, Teresa. Yes, the things are moving quickly this year with the legislature making the decision to operate on really this kind of accelerated schedule for this year. Things have been happening very quickly. So that's been an exciting time for us to try to keep up with all the things that are going on. As far as current issues, a lot's happening. For example, just within the last 24 hours, we've had a number of things occur. The governor last week had vetoed Senate Bill 63, which is known as the Help Not Harm Act, related to gender services, gender transition services. And so that she did veto that on the 11th, but yesterday the legislature overrode her veto on that. So that bill will go into effect upon publication at the Kansas Register. And again, just really quickly, has a number of provisions in there that relate to prohibiting certain services that are being provided. Particularly, this is for youth and related to gender transition. So that bill will be going into effect as soon as it gets published in the Register. The other thing that happened yesterday was that the legislature the House passed their budget bill. So this is House Bill 2007. This is, again, a change for this year with having the House sort of kick things off and have a bill going right away that they worked on to get their budget put into place. And so that bill was passed yesterday, and it will now go to the Senate for consideration, and we'll see what happens on the other side. But so there are, usually the budgets are something that sort of happen at the end of the session, but the way that they're doing it this year, things are moving much quicker, and they're already kind of halfway there at this point. The other thing that happened yesterday also was there were a couple of attempts to insert Medicaid expansion into a couple of bills that were being debated by both on the House side and the Senate side. So, we had mentioned before that the governor had introduced a couple of bills, both on the House and the Senate side, related to Medicaid expansion. Neither of those specific bills have gotten a hearing, but there were attempts on the floor to insert Medicaid expansion into a couple of bills. One of those being the budget bill that I just mentioned. So House Bill 2007, that amendment didn't pass. And then also there was an attempt to add it into what is known as Senate Bill 161. Senate Bill 161 is a bill that puts into place a requirement that any changes in public assistance programs, including Medicaid, would require legislative approval before that could be done by the agency. So any agency that was overseeing those programs. So that bill actually did pass, Senate Bill 161. Again, there was an attempt to add Medicaid expansion into that, and that amendment did not pass.
And I might interrupt just for a second so we can take a step back and talk a little bit about the timing of everything. I mean, this session is expedited, and can you talk about why that is and what that means for the entire legislative process?
So yes, it is. They are up, as I sort of alluded to at the beginning, they are operating on this kind of expedited schedule. I've been here at KHI for a little over 10 years, and, we've been monitoring the activity of the legislature all that time. And historically, the legislature has not adjourned until really very early in May. This year, the rules came out for the legislature that they are really shooting for trying to be done by April 12th. So, this is a good 3 weeks earlier than typically they've been done in the past. Leadership had indicated that, the Constitution really does provide, the Kansas Constitution does provide for a 90-day session. And, in the past, it's been 90 days, but there have been breaks in there. And so they pretty much eliminated all of those breaks and are just moving straight through and really trying to stick to this 90-day schedule as stated in the Constitution. So it has just made things move much quicker. One of the things that's happening. So we're recording this now. Tomorrow, February 20th, is a turnaround day. So that is the day that all the bills that started in one chamber have to be moved over to the other chamber in order to still be active, except for those bills that are in exempt committees. So again, that's another thing that's just happening really fast. So within the last couple of weeks, both chambers have been working really hard. The committees have been working really hard to get hearings done, get bills worked and passed out of committee so they can go to the floor. And so it's just been a really fast pace, unusual, but they're working very hard and getting a lot done in a much shorter time.
And we might talk a little bit about how KHI monitors the legislation. We obviously keep our eyes on things that are related to health, and we define health very broadly. But can you talk about how the KHI legislative monitoring team kind of divides and conquers and then, pulls everything together for a weekly recap?
Yeah, so our legislative monitoring team, we split up all of the committees at the beginning of the session. We try to identify those committees that we think may be working on health-related bills throughout the session. And then just from day one, we start monitoring everything that they do. So we monitor the hearings that they hold. We monitor and track bills as they go through the process, pay attention to what's happening when the legislators are on the floor and things that are getting done as they move through. And then every week we try to pull all of that information together in a big summary to let our audience and our stakeholders know sort of what happened in health. And so that's why we have Health at the Capitol is our summary that we put out every week that tries to give you an idea of everything that's been happening in all of the committees across them. And, we're talking about 14 plus committees that we end up monitoring ultimately that have done anything that's related to health in any way. And so it runs the gamut. And you're right, we do define health very, very broadly. So we also include things like child welfare in there and juvenile justice, and then any bills that sort of impact any kind of thing that's related to health in any way, including the way things are done in public health and a lot of other topics as well. So we cover a lot of material.
Oh, right. And I know a lot of organizations do something sort of similar where they're monitoring legislation. The unique thing about the Kansas Health Institute is we're nonpartisan, non-advocacy. So when people are receiving this information, they may use it for those sorts of purposes, but it's coming out as kind of fact-based. This is exactly what happened, sort of information that anybody can use, which is really nice.
Yes, that's exactly right. And that really is our goal. Our goal is to provide information to everybody, and it is very fact-based. It is this is what the bill says. This is what the discussion was during the hearings. These are the kinds of questions that legislators asked, and we really do want people to have the information, and then however they choose to use that information, that we think that's great, and they can do that. But our goal is to put information out there that people can use.
All right. And, we made some slight adjustments with the naming of the strategy area that you're focused on this year. So, given all that's happening at the federal level and in combination with the state level, we have that dual focus this year for sure. Can you talk a little bit about with the administration change at the federal level, what sort of impacts does that have on politics or decision making here at the local level?
Yeah. So this year, KHI, in our strategic plan, we renamed our strategy area. It's still the same thing, but we just called it something different because we really felt like we needed to make it more clear what our intent is. But it is now the state and federal health policy strategy area that I'm responsible for. And we've always done this, but the goal really is to not only focus on what's happening here at the state, and obviously the legislature being a big piece of that, but also paying very close attention with a new administration coming in this year at the federal level, and anything that is going on at the federal level, either in a regulatory way or certainly in a legislative way through Congress, as well as any administrative orders that come from President Trump that potentially impact what happens at the state. And that is very much true. So this is really a very fast-paced time. We just have had a new Secretary of HHS, Robert F. Kennedy Jr. was confirmed. And we've got some indication of the things that he's interested in and what we might see coming down from the federal government that will flow to the states. There is a budget resolution that's currently being worked by Congress that would, at least at this point, certainly include some indication of some cuts to the Medicaid program. And again, that will flow down to the state. And then also the President Trump had also issued an executive order referring to what has become known as MAHA. So it's Make America Healthy Again. There's lots of comments in there about looking at things like nutrition and specific with a really very specific focus on the health of children. So I think we'll see some things coming down from that as well. So we'll, with just that very recent confirmation of the Secretary for HHS, we expect to start seeing some things come out. And so it's very important, I think, for us to monitor all of that activity as well, and then provide that information to our audience. So we'll be doing that.
For sure. And bringing it back to the state level again, do you want to talk a little bit about what's to come? What are we expecting to hear debated or discussed?
So I obviously, as I mentioned, with House Bill 2007 being passed by the House, that'll now flip over to the Senate side. And so they'll be getting quickly into that hard work of going ahead and finishing up the budget. And again, there are a lot of bills that have now come from the House that are moving over to the Senate and vice versa. So they'll all be dealing with all of the bills that came over from the other side that they now have to consider. So again, another very quick round of hearings and working those bills and then passing them out to their respective chambers as well.
All right. Sounds great. Anything else you want to add before we wrap up?
No, I don't think so. But thank you. Again, stay tuned. We have a lot of information coming out every single week. And it again, as fast paced as it is, we're doing our best to keep up with it. But there's a lot going on and a lot for everybody to be paying attention to. So we're doing our best to keep you up to date.
All right. Thanks so much, Linda. And as Linda mentioned, you can stay up to date by logging on to a computer, grabbing our webpage, khi.org, and signing up for our weekly emails. You'll receive not just the weekly recap, but lots of other great information as well. And you can also continue to tune into our webcast. We'll have this monthly summary of what's happening at the Capitol. Thanks for joining us for Health at the Capitol. Sign up to receive our emails at khi.org to get a weekly recap of health policy activity during the Kansas legislative session. You'll also receive our latest publications and information about upcoming events.